I'm Edgar Martinez from Blaine College. Does it look good? Okay. Alright, hello. I'll be talking about the coronavirus and viruses, well, mostly vaccines. Okay, so, in order to create a safe vaccine for all of us, for public use, the CDC recommends, well, has as a regulation of 6 major steps or stages. The first one is exploratory, which is basically what's called reading the genome of the virus, and then the second one would be preclinical, clinical development. The fourth one will be review and approval, and fifth will be manufacturing, and sixth will be quality control. So with all those 6 steps, there's one that takes the longest, and that would be the third one, which is clinical development. Clinical development, what it does is that is whenever we test on humans. And when we test on humans, we start with a small batch of humans, which is around to 10 to 100. And from there, we progressively go to the masses, to hundreds, to not if even thousands. And that is the basic rules of vaccines. Vaccines in general take around 10 years to produce, to make sure they're of top quality and top efficiency. Okay. All right. So, with this coronavirus happening today, we are facing a lot of challenges, from mental to economic, and for all of us, we're dealing with it, and we all know someone that has been affected by this. But some people are becoming impatient about opening it up, and why this vaccine is taking so long, and I will focus on that. The reason why this vaccine is taking so long, even though scientists and researchers have been speeding up to the point that some experts are saying that we'll have one within a year, and that is mind-blowing. And the reason being, and the only reason why that is even possible to this day, is one, that it is a global epidemic, really, and that's the main reason why they're doing this. And the methods that they're doing this is 3. 1, the way they're doing it is, whenever this virus came out in China, they did the DNA sequence of the virus and quickly try to find its weaknesses. And that is one way we quickly did that. The second way, and the first one is according to the CDC. And then the second one is that instead of starting off with animal trials, we are now going on to human trials. And we're just skipping that one. So, as of right now, most of them are in clinical development. And the thing is, that is bringing up some ethical problems. And the reason being is because these people are taking huge risk because we don't know if they're effective or not. Or they might even harm us and even help the virus, unfortunately, kill off the person who has the virus and this prototype vaccine, according to nature.com. And third and not least, SARS and MERS are very closely related. They're from the same family tree of virus. And what researchers are doing is relating them and using their past knowledge from these other viruses on how this virus, coronavirus, will react, and how some potential vaccines and antibodies and all these treatments may help us in the long run. But as of right now, what I will say to people is that it is mind-blowing that we'll be able to create a vaccine within a year. But the thing is it worth the risk that it might impose? Is it possible it can harm us, or can it really help us? For the most part, we believe that it will help us. But for the people who are doing the clinical trial, we don't know. And that's how I'll end this. Thank you.